What if the world's most skilled surgeon could operate on you tomorrow? Not by flying across continents, but by guiding robotic instruments from a control console 3,000 miles away, while artificial intelligence monitors your vital signs 1,000 times per second, detecting complications before human eyes could perceive them?
Your Tuesday arrived when rent jumped $500 and your salary didn't. You're doing everything right, yet you're still one bad month from disaster. What if you could reach financial independence in 7 years, not 40, without quitting your job, without coding? Just AI tools that turn 30 minutes of work into real income streams. Inside AI-powered financial independence, you'll get the real freedom number, 5 beginner-friendly passive income ideas for busy professionals, and a 30-day blueprint to your first $500 per month, no experience needed. Real people, like Emma, the marketing manager who retired at 39, or James, the bank analyst earning $3,400 a month on the side, are already doing this. They weren't special, they just learned the system you haven't been taught yet. The book is just $11.99, less than 2 takeout dinners. For that, you get a year-by-year roadmap, real numbers, and AI strategies that actually work. 7 years from now, you'll be 7 years older, whether you start today or not. Your choice is now. Link in bio to get AI-powered financial independence on Amazon.
This isn't speculative fiction. By 2026, AI-augmented remote surgery has transitioned from experimental demonstrations to routine clinical practice across 47 countries, fundamentally dismantling geography as a barrier to surgical excellence. This represents a paradigm shift in how we conceive of medical expertise. The infrastructure enabling this transformation combines 3 converging technologies matured by 2026. At the core is ultra-low latency 6G networks delivering sub-10 millisecond transmission times. In the world of surgery, where a millisecond can be the difference between safety and catastrophe, this speed is essential. 6G provides the ultra-reliable, low-latency communication needed for real-time instrument control, ensuring that a surgeon's movement in London is reflected instantly in an operating room in rural Asia. It's the silent highway of the medical revolution, supporting millions of data points every second without fail. Beyond the network, next-generation surgical robots utilize multimodal AI trained on millions of surgical hours. These systems recognize anatomical variations and complication precursors with superhuman pattern recognition. The breakthrough isn't fully autonomous AI surgeons making independent decisions. That capability remains ethically constrained, but rather sophisticated human-AI collaboration. Think of it as an AI co-pilot that provides real-time guidance, complication prediction, and micro-motion stabilization that eliminates human tremor entirely, allowing for precision previously thought impossible. AI is the surgeon's ultimate partner. Preoperative planning has been revolutionized by AI-generated digital twins. By 2026, computer vision modules process preoperative CT and MRI scans to create high-fidelity 3D reconstructions of a patient's specific anatomy. These models allow surgeons to practice the procedure in a virtual environment before making a single incision, identifying potential complications, and optimizing the surgical approach tailored to the unique geometry of the individual. This pre-visualization ensures that when the first cut is made, the surgeon has already navigated the complexities of that specific body a dozen times in simulation. The physical tools of the trade have also undergone a radical miniaturization. AI-driven robotic systems are now smaller and more agile than ever before, enabling ultra-minimally invasive procedures. These tiny robotic arms can enter through smaller ports, resulting in significantly less surgical trauma, faster recovery times, and a drastic reduction in hospital stays. This miniaturization, combined with AI-guided precision, marks a shift toward trauma-free surgery, where the impact on the patient's body is minimized to an extent that was once thought impossible in traditional surgery. Perhaps most impressive is the maturation of haptic feedback systems. Surgeons can now transmit tissue-resistant sensations back to the remote operator. This sense of touch, or transparency, allows a doctor thousands of miles away to feel the tension in a suture or the density of a tumor. By 2026, tactile feedback has bridged the sensory gap, making remote surgery feel as visceral and immediate as standing right at the bedside. It restores a critical dimension of surgical intuition, the feel for the tissue, that was previously lost in translation between the human and the machine. Real-world impact is already visible. During a complex neurosurgery in rural Kenya last month, a neurosurgeon in Toronto controlled robotic arms through a haptic feedback console while an AI co-pilot analyzed live microscopy feeds. The system highlighted tumor margins invisible to the human eye and alerted the surgeon to a microscopic blood vessel 30 seconds before rupture risk peaked. This intervention prevented a catastrophic hemorrhage in a region that previously lacked any neurosurgical specialization. It's a symbiotic model where AI and 6G extend human capability to the farthest reaches of the globe. Rural hospitals previously unable to attract specialized talent now deploy standardized robotic pods. These compact units fit into existing operating rooms and connect to global talent networks. Specialists can perform procedures remotely during their off hours, dramatically increasing access to expertise once concentrated in elite urban medical centers. A pediatric cardiac surgeon in Boston might perform 3 valve repairs before breakfast for children in Bangladesh, Mongolia, and Peru, all without leaving her home city. This redefines what it means to be a global medical community connected by care. This democratization effect is most transformative in low-resource regions, where surgical mortality rates previously exceeded 20% for routine procedures. Early 2026 data from the WHO's Global Surgical Observatory reveals a 38% reduction in post-operative complications across participating rural hospitals using AI-augmented remote surgery. As AI systems learn regional anatomical variations and resource constraints, this gap continues to narrow, bringing world-class care to the most vulnerable populations on Earth. Healthcare is finally becoming a universal right rather than a privilege of geography. The Smart Hospital of 2026 is a fully digital connected ecosystem. 6G technology networks every medical device, from life support systems to smart beds, ensuring that patient data flows seamlessly between departments. This integration supports ambient AI systems, digital scribes that handle the heavy lifting of documentation and record keeping. This allows surgeons and nurses to reclaim their time, focusing on what matters most: the direct, compassionate care of their patients. AI isn't just operating, it's managing the entire environment of healing, ensuring maximum efficiency for all. The integration of 6G-powered wearable sensors further enhances this model. Data from fitness trackers, implantable devices, and environmental sensors is aggregated in real time, providing surgeons with a complete picture of a patient's health before, during, and after surgery. Contactless sensing technology can even monitor vital signs remotely without wires, allowing for continuous, non-invasive observation in both hospitals and home care settings. This level of data integration means that a complication can be predicted and prevented days before a patient even feels a symptom, closing the gap in preventive care. The training implications are equally profound. Surgical residents in developing nations now train on AI-guided simulators that provide instant feedback on instrument handling and tissue respect. This compresses years of apprenticeship into months, building muscle memory through haptic systems that replicate tissue resistance with astonishing fidelity. These trainees then perform initial supervised procedures with AI co-pilots providing real-time guidance. highlighting optimal suture placement and warning of tension points before a tear can occur, creating a new generation of hyper-skilled surgeons worldwide, ready for any complexity. To govern this boundaryless medical world, 2026 has seen the emergence of the Global Telesurgical Ethics Board. This international body, supported by the WHO, works to establish standardized protocols for safe, ethical, and inclusive implementation. They tackle the difficult questions. How do we ensure equitable access for low-resource nations? How do we standardize consent procedures across cultures? By promoting a unified ethical framework, they ensure that the technological revolution serves humanity as a whole, preventing a new digital divide in life-saving care and fostering trust in these new systems. Yet, this transformation faces profound challenges. Network reliability remains life or death critical. When a monsoon disrupted satellite links during a remote procedure in the Philippines last January, the AI system's autonomous stabilization protocols were put to the ultimate test. They maintained instrument position for 97 seconds until connectivity was restored, preventing catastrophic damage. This event revealed a dangerous dependency on infrastructure vulnerable to climate events and cyber attacks, demanding that we build even greater resilience and local backup capability into our global networks. Regulatory fragmentation creates further inconsistencies. Procedures legal in one country face prohibition across borders due to medical licensing laws written before remote surgery existed. This forces complex liability arrangements where responsibility is dispersed across the surgeon's home jurisdiction, the patient's location, and the AI developer's country. Insurance markets are still struggling to price risk for procedures where human error, algorithmic bias, and network failure intertwine. We need a unified global framework to ensure that innovation doesn't outpace our ability to protect patient rights and safety. The human element introduces subtler complications. Studies from Johns Hopkins reveal that surgeons operating remotely for extended periods experience presence erosion, a gradual disconnection from the visceral reality of tissue manipulation. Simultaneously, patients report psychological discomfort knowing their incisions are made by robotic arms, controlled by someone who has never stood in their room. New models of teletactile compassion are being developed to bridge this gap, using video and haptic presence to ensure that while technology bridges distance, it doesn't eliminate the essential warmth of a human presence. Looking toward 2030, we envision the rise of even more advanced, semi-autonomous surgical systems capable of handling emergency trauma care in the most extreme environments, from deep-sea research stations to future lunar bases. These systems will not replace human judgment but will serve as an ever-ready extension of our collective medical knowledge. The era of trauma-on-demand support will ensure that no matter where a human being is, the world's best surgical wisdom is only a heartbeat away, powered by the fusion of machine intelligence and human ingenuity. The operating theater without walls represents not the end of surgical artistry, but its expansion to every corner of our planet. AI serves as the connective tissue that makes expertise universally accessible, while demanding new ethical frameworks to govern this fusion of human judgment and machine precision. This balanced approach recognizes that surgery remains fundamentally human-centered. Technology should extend compassion across distance, making world-class healthcare a reality for all. The future of surgery is global, precise, and profoundly human. Healthcare is no longer limited by walls.
The true global impact of AI-augmented remote surgery extends far beyond individual procedures into systemic transformations reshaping healthcare economics, medical education, and geopolitical power structures by 2026. Traditional surgical training pipelines requiring decades of concentrated mentorship in elite institutions now face disruption, as AI-guided simulation platforms enable competent surgical performance development in regions previously excluded from specialized training, creating the first generation of world-class surgeons emerging from rural Africa, Southeast Asia, and Latin America without relocating to Western medical centers. This talent democratization triggers reverse brain drain as surgeons trained locally with AI augmentation choose to practice in their home communities, rather than emigrating for career advancement, gradually rebalancing global surgical workforce distribution that has long favored wealthy nations. Economic models transform equally dramatically. Hospitals and resource-constrained settings achieve financial sustainability by offering specialized procedures through remote partnerships that previously required expensive physician recruitment packages, while surgeons in developed nations monetize expertise across multiple time zones, performing procedures during off-hours for international patients, at premium rates that fund their domestic practices serving underinsured populations. This creates unexpected cross-subsidization, where a neurosurgeon's remote work for wealthy international clients finances pro bono care in her home city, a model scaling rapidly through platforms like MedRover and Surgalink that match surgical talent with global demand while handling complex billing, liability, and regulatory compliance. Pharmaceutical and medical device industries face disruptive pressure as AI systems identify optimal instrument designs and drug protocols, with statistical power impossible through traditional clinical trials, accelerating innovation cycles while challenging patent frameworks designed for human-led discovery processes. Yet these benefits concentrate unevenly along digital infrastructure divides. Nations with robust 6G networks and reliable power grids reap transformative benefits while regions lacking basic connectivity watch surgical inequality widen, despite technology's theoretical universality. A paradox where the tool designed to eliminate geographic barriers actually amplifies existing infrastructure disparities. Ethical dilemmas intensify around algorithmic bias as AI systems trained predominantly on data from wealthy populations demonstrate reduced accuracy. When applied to anatomical variations common in underrepresented ethnic groups, during a 2025 trial in Nigeria, an AI guidance system misidentified tumor margins in 15% of patients with darker skin pigmentation affecting tissue visualization, revealing dangerous blind spots that could perpetuate healthcare disparities under a veneer of technological neutrality. Regulatory bodies scramble to establish oversight frameworks that balance innovation velocity with patient safety. Singapore's Health Sciences Authority pioneers sandbox approvals, allowing limited autonomous functions under strict monitoring, while the European Medicines Agency demands exhaustive validation of every AI decision pathway before clinical deployment, creating regulatory arbitrage where developers launch first in permissive jurisdictions before navigating stricter regimes. The liability landscape fractures most dangerously when an AI-augmented remote procedure results in patient harm. Determining responsibility becomes complex. Is the remote surgeon liable? Is the AI developer responsible for training data gaps? Is the hospital accountable for network infrastructure failures? Current malpractice frameworks collapse under these distributed causality scenarios, forcing emergency legislative action in 17 countries during 2025-2026 to establish proportional liability models, allocating responsibility across human operators, AI systems, and infrastructure providers. Military applications introduce geopolitical tension as nations develop battlefield surgical robots capable of life-saving procedures in active combat zones, without exposing human medics to danger. Capabilities that blur lines between humanitarian innovation and weapons system development. China's deployment of autonomous field surgical units along disputed Himalayan borders and the United States' Project Medusa battlefield robots trigger diplomatic concerns about medical neutrality erosion while demonstrating undeniable life-saving potential in conflict zones. The most profound impact emerges in global health security. During the 2025 Marburg virus outbreak in Uganda, remote surgical teams performed procedures on infected patients while remaining outside containment zones, preventing healthcare worker infections that historically accelerated epidemic spread, a capability that transforms pandemic response protocols worldwide. This experience catalyzes WHO coordination of a global surgical response network. Standardized robotic pods pre-positioned in strategic locations worldwide, ready for rapid deployment during health emergencies with AI systems, pre-trained on outbreak-specific protocols. By 2026, this network stands operational across 63 countries, representing humanity's first coordinated infrastructure for delivering specialized surgical care during crises, regardless of local expertise availability. Yet the technology's success creates uncomfortable questions about healthcare's future human essence. As AI systems achieve superior outcomes in technically demanding procedures, do we risk losing irreplaceable human qualities, intuitive adaptation, compassionate presence, wisdom gained through decades of accumulated experience that defies algorithmic codification? Leading surgical educators now advocate for augmented humanity models, where AI handles precision execution while surgeons focus on holistic patient care, complex decision-making, and mentoring the next generation, redefining surgical excellence not as technical perfection, but as wise integration of machine capability with human judgment. The 2026 landscape therefore presents not a finished transformation, but a critical inflection point where AI-augmented remote surgery proves its potential, while exposing unresolved challenges in equity, accountability, and human meaning that will determine whether this technology elevates healthcare. The outcome depends not on technological advancement alone, but on conscious choices about governance, access, and preserving medicine's human core. Even as its tools evolve beyond biological limits, choices that define whether surgical excellence becomes a universally accessible birthright or privilege of the few. If you found this exploration of AI-augmented remote surgery's transformative global impact insightful and valuable, please subscribe to Tomorrow Intelligence for our ongoing coverage of breakthrough innovations reshaping our world. Like this video to help others discover how AI is redefining the boundaries of human capability in medicine and beyond. Share with fellow healthcare professionals, technologists, and policymakers who understand that the future of surgery isn't about replacing human hands, but extending compassion across every border on our planet. Hit the bell icon to receive notifications. Whenever we publish new content examining how artificial intelligence, robotics, and human ingenuity converge to solve humanity's greatest challenges. Tomorrow, Intelligence delivers deeply researched analysis, separating genuine breakthroughs from overhyped claims. Because understanding our future requires clarity. Join our community of forward-thinking innovators building the equitable, compassionate world we all deserve. Tomorrow Intelligence, clarity, not clickbait.